Hello and welcome to the latest episode of The Talking Tradesman. With me in the studio today, I have Dr. Henry Aughterson. Right that time?
Yeah, just about.
Fantastic. Also known, if you go on social media, as Dr. Mental Health. Henry, let's talk.
Let's talk.
Let's talk, mate. Really appreciate you coming up today. I know you've had a bit of a journey to be here, and appreciate you reaching out to come on the podcast because, you know, who better to have on a mental health orientated podcast than a doctor who specialises in mental health. So really appreciate it, mate. If you can tell us a little bit about you and your background, that'd be great.
So started medical school about 11 years ago now at UCL, University College London. And most medical schools in the UK are kind of split by 3 years preclinical and 3 years clinical, or 2 years preclinical and 3 years clinical. So you do a lot of the kind of theory stuff for the first couple of years, anatomy, physiology, the kind of science underpinning clinical medicine, and then you do the final 3 years in hospitals and GP surgeries. So I did 3 years preclinical, which at my uni also had a BSc year, which I did in global health, and then I did 1 year of clinical. And during that clinical year, I think quickly became quite disillusioned with how we were kind of not really able to help patients particularly well with the root cause aspects of what was going on for them. And for me, a lot of the time in modern healthcare, that was behavioural or social or mental in some way. Not all, but like a huge proportion of healthcare. And it seems like we were kind of treating patients in hospitals, sticking plasters on their problems metaphorically, and then sending them back out into the conditions where they'd become unwell. And I think I became quite disillusioned with that, and I kind of became really fascinated with how we can support people before they get sick, I suppose. So kind of prevention first and foremost, rather than just treatment. And at the time, something called social prescribing was becoming slightly sexy within public health anyway, which is all about connecting individuals to community groups and activities. So I applied for some funding to do a PhD, leave medical school for 3 years, and kind of research these sort of more root cause aspects that can support people's mental health. So I did that for a few years and then came back to medicine, finish off medical school, and now I'm a junior doctor with a kind of research interest or specialist interest in mental health, I guess.
Fantastic, mate. So am I right in thinking you work in A&E currently?
Yeah, currently. So doing various rotations, but I've been in A&E for a few months in Kent.
I imagine you see some sites. First of all, before we sort of move off the subject, one of the things that I want to pick up on, because what you've just said there is something that I've preached many, many times, which is the fact that a lot of treatment when it comes to sort of like NHS treatment is focused on the symptom, not the cause. And you've just echoed exactly that, is that it's a really powerful thing for people to realise, really, that a lot of the things that get treated are the manifestation of the actual root cause of an issue will then manifest itself in actions and behaviours that then get treated. So that the behaviour gets treated. I mean, let's pick one out, like OCD, for example. I know that's a big one, because OCD, listen, you're the professional here, so please correct me if I get this wrong. But OCD a lot of the time is treated with CBT.
Yeah, it can be.
And from the research that I've looked at is that if you don't then treat the root cause of the OCD, what can quite often happen is it just passes on to either a different form of OCD or a different manifestation of a mental health sort of issue. Would
I
that
think
be
that's
right?
probably true. So I think OCD is typically you have obsessions and compulsions, right? There are variants of that, but that's the idea. Someone frequently gets certain obsessions, and then they do particular compulsions to kind of ease that anxiety or obsession. And CBT is one of the treatments for it, along with medication and other forms of therapy. I think it's not as simple as just as tackling the root cause in something like OCD, because I think there's definitely a genetic component for some people with conditions like OCD where
Okay.
maybe there's not a root cause. I mean, some people would disagree with that, but I think there are genetic underpinnings to things like OCD. You know, for example, higher than usual amounts of dopamine floating around in your brain and things like that. And so CBT can be an incredibly effective tool, but it is true that, yeah, often there are root cause things underlying OCD as well. So it's probably not the only thing that you should do for it. But I think across a range of mental and physical health conditions, you know, we love to medicate in this country, in the world, don't we?
Yeah.
Doctors are addicted to this, patients are addicted to this, and this is not just in mental health, this is physical health as well, you know, whether that's blood pressure medication for high blood sugar, weight loss drugs, etc. You know, there's a role for medication, obviously, but if
Yeah.
you're not addressing what's actually causing the problem, which for a lot of people is, you know, to do with health behaviors, their social circumstances, their mental health in some way, then you know, it's going to be, the treatment's going to be a lot less effective. You're going to become reliant on medication. You know, we need to empower individuals to kind of create their own change. Basically, that's both mental health and physical health. We can't be entirely reliant on medication, which I think most people would agree with. But you know, as doctors,
The medication, yeah.
we're guilty of over medicating people, but people also want quick fixes, and for a lot of the time in mental and physical health, there aren't quick fixes, there aren't magic bullets, and these, you know, the pills that we give.
I think, yeah, I mean, medication's a bit of it's a hot topic, isn't it? Because then you can easily drift onto big pharma and profit lines and who's because there are people getting very, very rich from certain medications.
Sure.
My personal view, I'm not anti-medication. I think it should be a combined treatment. Whereas a lot of the time medication becomes the only treatment.
Absolutely.
So, you know, somebody will come to a doctor and present themselves with a certain condition. They'll be medicated, but again, that root cause of what got them there.
Yeah.
I mean, you know, you pick on an easy one here, being obesity. I don't really know what the medications around obesity are, but the root cause obviously would be lifestyle.
Yeah.
But it's how much of that actually gets addressed opposed to the medication.
You know, there's definitely a place for medication and for drugs, you know, within fat loss, because, you know, obesity is, you know, something that's been increasing massively. Childhood obesity, you know, smoking, we've kind of...
If somebody's at risk of, you know, that their BMI is so high or whatever it might be, that they're at risk of things like heart attack and things like that, then absolutely bring in medication to help alongside lifestyle.
Exactly. And it's similar within mental health, I think, isn't it? I think there's definitely a place for things like SSRIs, antidepressants, and we absolutely shouldn't shame anyone who's on medication. But and it's, you know, it's a useful tool. But I think if that's the only thing being done, you know, they don't address the root cause of what's going on for people a lot of the time, if there is a root cause. So as you say, yeah, it has to be done alongside kind of psychological and behavioural support as well.
I mean, when it comes down to, because to me, again, so this is just my opinion, but the way I look at it, again, I'm not anti-medication. I believe if somebody's at point of crisis, medication's great. You know, if that's going to level somebody out to the point where they can then begin to look at what got them to that stage. But you would think, or my opinion would be that medication should be sort of like brought in alongside some sort of counselling therapy. If that isn't the case, is it just a funding thing? Like, is it just that the money isn't there to provide that?
I think there's a lot of reasons for it, but yeah, I mean, certainly within the NHS, it's pretty hard for a lot of people to get the therapy that they kind of deserve and need a lot of the time. And if they do get it, it might be limited to, you know, 8 weeks or something.
Yeah.
And also the kind of stresses that doctors are under, that GPs are under, you know, have to have 10-minute appointments with people. I think the average length of an appointment in the UK is 9.5 minutes. You know, how do you really get to the root cause of what's going on for people and support them, you know, with their kind of psychological concerns in that amount of time, whilst also having to, you know, get through a full range of questions on their physical health and everything else. So sometimes, you know, we're all to blame for looking for those quick fixes, and sometimes there's you know, there's no other option. Sometimes people, want that as well. They want, they don't want to go down the therapy route, and they just want to try out medication for a bit. And they're, obviously within their right to kind of do that as well. But yeah, I mean, a big part of it is funding, and we have a significant lack of funding in mental health services in the UK that's been going on for decades. So.
Absolutely. I mean, I touched on this in the last episode I did. There's a bit of a misconception, I believe, that because I think mental health is probably more spoken about now than it has been ever before, which is great. But that leads into a misconception that because it's being spoken about, it's being dealt with, which I don't believe it is. And when it comes to the governmental budget sort of like allowance towards mental health and the cuts, it's been consistently cut since I think the 50s. Ever since it became care in the community, the budget, the mental health budget in the UK has been sliced.
Yeah, absolutely. I think it costs the UK economy like £300 billion or something, poor mental health. So it's, we need to make that economic argument almost that actually,
it would
by supporting people's mental health, you'll, save huge amounts of money, in terms of days lost at work, but also kind of unproductivity. I don't think we should be supporting with mental health purely for economic reasons, but sometimes it's helpful to make that argument as well, because it's
the way to sell it to the government, isn't it?
Yeah.
Let's be honest. I mean, interestingly, with you working in like A&E and that kind of thing, do you see, and I don't want to be leading with these questions, I be honest, do you see that there's a strong correlation between mental health sort of cause and the people that are ending up in A&E? Is there a large proportion of that?
Yeah, it's a good question. So I think there's kind of people who present primarily with mental health problems, and then you have people who are presenting with physical health problems that have a strong mental or psychological or social underpinning, right?
That's what I was getting at,
yeah. To think about just the kind of primarily mental health patients, it's extremely common. It's even more common than I would have realised. It's probably the top, it's in the top 3 presentations that you see as a doctor in A&E would be mental health, and within that you'd have overdoses, suicidality, suicide attempts, psychosis episodes. It's incredibly common. It's a big part of what you do as a emergency physician, and we're pretty poorly equipped at helping a lot of these people. Ideally, my hospital, my A&E would have a psychologist or therapist on site that could, talk to people every time they come in. We don't really have that. And there's not always a lot we can do in A&E for people other than
treat the physical.
Just, damage control, treat the physical, hopefully link them up to services in the community following their kind of visit to A&E, but it's difficult. You don't follow up on that. You don't hear what happens to a lot of these people. But yeah, it's really sad, the level that you see in emergency medicine.
I must say, mate, I mean, what was a big eye-opener for me, where I sort of realised just how many people in society were suffering, was I volunteered at Samaritans for about 18 months.
Great.
And one of the biggest surprises when I did that were the sheer volume of mental health-related calls that we received. And off the back of that, there would be people who were severely mentally unwell. We're talking like full psychosis. And they were being told to ring Samaritan service by their mental health teams, by the worst occasion that I had, a worst case that I had, was a phone call that went along the lines of they were having severe suicidal thoughts to the point of planning, and that they'd rung their mental health emergency line, whatever it is that they're given, to be told that there was a 4-day wait for a callback and that they should ring Samaritans.
Yeah, it's awful. Yeah. And Samaritans do truly incredible work. So it's great that you have volunteered with them. But it's also, it's filling a void, isn't it? It's filling a hole, and that arguably, the state should be filling a bit more. And
look, Henry, I'll be honest, mate. I mean, I performed the role for 18 months I'm a volunteer.
That's the thing.
I'm not medically trained.
You're not a specialist kind of mental health worker, and the volunteers at Samaritans do an amazing job, and they have great training. But no, they're not a trained mental health specialist. And thank God it exists, but equally,
It definitely saved lives. It was just such a big eye opener for me. The high proportion of, I guess, mental health calls that we were taking, and also the people that seemed very much lost in the system. It was a common thread of, well, we've actually been referred to you by our mental health team through the
100%.
NHS,
Right. Wow.
and it seemed a bizarre thing for me that an NHS mental health team would be referring people to a voluntary organisation.
People feel abandoned a lot of the time, don't
Oh
they?
yeah,
By
yeah.
by mental health support that they've got, whether that's in hospitals or in the community, and getting lost in the system is, that's not unique to mental health. It's, that's a big problem across the NHS in general, isn't it? We are kind of failing a lot of people at the moment.
Let's pause there a moment to thank this episode's sponsors, Q1. Q1 are a premium masking solution. They offer the ultimate choice for professionals that demand perfection. Whatever you're painting, Q1 tapes deliver clean, sharp lines every time. Q1 tapes are designed for superior adhesion and easy removal, leaving no residue behind. We use Q1 tapes in our business all the time, on every job. In addition to the painter's tapes, Q1 offer a range of surface protection technology, solutions and accessories. You can cover things like worktops, hard floor and kitchen units with a range of Q1 protections. Using Q1, your projects are going to look professional and the results will speak for themselves. Q1 is available at all of your favourite stores and online at q1tapes.com. Thank you to Q1 for supporting the Talking Tradesman podcast and helping us raise mental health awareness in the industry. Let's get back to the episode. Yeah, and look, I've got to be very careful with it because I think the NHS are a fantastic organisation. Some of the things I say might come across that I'm anti-NHS or that I'm bashing the NHS. That isn't the case. I think they're absolutely vital. They're just struggling. I think there's a lot of departments that are on their knees, and mental health would be the big one. That it's such a prevalent problem in today's society and the funding just isn't there, or it's been withdrawn. It seems that the problem's growing and consecutively the funding is being pulled.
Yeah, and it's not just funding, isn't it? I think it is funding, but it's also addressing things at the root cause, working with schools, with education. It's, dealing with changing demographics, aging population that puts enormous amount of, pressure on emergency services. It's lack of care in the community. It's lack of funding into social care. It's an incredibly complex kind of thing that doesn't have any one quick fix. And, funding is part of it. We need more trained mental health specialists. We need more therapy that's available for people. But it's just one part of the puzzle, isn't it?
I've got a lot of respect for you, mate. In terms of, you're obviously taking your medical path, but also doing the mental health awareness side that you're doing. Obviously, I've seen your Instagram page. Go and check that one out, which is Dr. Mental Health.
Yeah, Doctor.
Is it underscore mental health?
Think, yeah.
Go and check out Henry's page. But yeah, a lot of respect for that, mate. I think if more people like yourself were to do that, it'd be really positive. Have you found that through that channels? Has anyone reached out to you through that?
Yeah, quite a few. I think you reached out to me, by the way, didn't you? I think
possibly.
Anyway, whichever way around. But so yeah, I mean, people like yourself, lots of people that I was, I wasn't really expecting it to be a big, networking thing, but actually, it's been kind of amazing for meeting, people such as yourself doing really cool stuff in this space, not just within my silo of medicine. I set it up mainly because I was junior doctoring and not really having this passion of mine kind of like itched, I suppose. And I wanted to reach some people with some videos and hopefully, connect with kind of people doing similar things, but was wary about starting it because of issues I have with Instagram and social media, and it's certainly.
Let's touch on that.
Yeah, Henry. We can touch on that. And I hadn't really, used Instagram from a personal point of view properly for a few years, just because I found I was using it in an unhealthy way. So I was pretty cautious about starting doing Instagram social media posts. But I think there is a way that you can do it in a positive way. And obviously, you know, you're showing that, although you're doing even longer form conversations, which I think is great because it kind of, you know, moves away from that sort of clickbaity, you know, 3-second videos kind of.
Do you know what though, Henry? Yeah, I'd completely take your point, but at the same time, trying to like, it's a strange one because I remember saying this when I first started doing the podcast. I just wanted to put the podcasts out. I didn't really want to do the short form socials, but then it became apparent it's this beast that you have to feed in
100%.
order to grow the long form. You have to have. And I was very conflicted with the clickbait shorts that I put out because although I never edit a clip to make somebody look like they've said something they haven't said, so I wouldn't take out the, you know, do the beginning, take out the middle and click it.
I should watch
and
that
link
this,
it.
shouldn't I?
Absolutely. But it's always, you know, it's 30 seconds or a minute clips of what is said in conversation. I'm very aware that some of it is clickbaity. It's to draw people's interest. But there's a bit of a monster where I need to do that in order to grow the audience because I'm actually trying to get the message out to more people so it can help.
It's a balance. And like, you know, you're doing you're doing a very worthwhile thing and you're trying to create a positive message and try and help people. You know, you're not just doing, I don't know, silly cat videos, which are fine,
No disrespect to the cat videos.
No shade on cat videos. But I think, you know, what's something like TikTok has done has pulled everything towards these like, you know, 3-second kind of quick videos, encouraging people to just scroll, stay kind of, you know, focused on the screen, grab your attention for as long as possible, and, you know, cause quite a bit of damage. You know, I did a post on this earlier today just about, and there's a lot of good stuff going on social media as well. So I'm not criticizing the whole beast, but I think, you know, we've got to think about our relationship with our smartphones, with social media. You know, is it going everywhere with us? You know, we're feeling like we're not as present with ourselves, with other people. And I think we just have to be very mindful of that and, like, you know, try and create boundaries with these devices and with, you know, social media and things like that. So all of that in mind, I was quite wary about starting the kind of Doctor Mental Health project, but I'm really glad I did. But for me, I have certain healthy boundaries that I set up for myself with it.
Do you mind me asking what they are?
Yeah, so I think about kind of the most important thing for me, I think, is like physical separation with your device sometimes, because these are highly addictive devices, aren't they? They work on the kind of dopamine sensors in our brain. There's
the people that develop them have teams of psychologists that work out how to hook you because they want you
100%.
to. So
they don't necessarily let their kids use it. I mean,
so the average person is fighting against professionals that have designed it to be as addictive as possible.
Hacked our kind of brain neural pathways. So distance is the big one for me. I'm lazy. I don't have much willpower. If a phone is in my pocket and I'm doing something like reading a book or but the phone's there, it's gonna have a pull on me. I think most people are gonna have that. You've got this kind of addictive device in your pocket. It's gonna have a little pull. You're gonna kind of use it more than you want to use it a lot of the time. So for me, I have like we moved out of London recently, and we've got a small spare room, and me and my partner call that. What do we call that? We call that tech town,
Okay.
which is where we can use our devices basically, and the rest of the flat is kind of tech free.
Right.
That's been really like profound in the flat, because I come home and I connect with my partner, or I read a book, or I you know, cook or whatever it might be, and I'm just a bit more mindful in that space. And then outside of our homes, I think just asking ourselves the question more, you know, do I need this device for this journey? Because we don't always need our phones for every journey we go on, but most of the time, most people bring it. Do you know what I mean? I mean, we don't we've become so attached to these devices. They've become such extensions of ourselves that we don't even question how abnormal and strange it is. And very occasionally it just makes me, the state of this makes me very angry.
You saying that now has made me question. I'm
Well,
literally sat here now thinking, shit.
Well, I think we should just ask that question. You know,
Yeah.
if beautiful day outside, you know, I want to go for a walk, do I need my phone with me, you know, for that? You know, you kind of trick yourself, you know, oh yeah, I might need it for this. Oh, I might need it if I need to take a photo. I might. No, I mean, if you really want to connect with nature, don't bring your phone with you. Maybe you want to go to a cafe and read a book. Maybe you want to go for a walk with a friend. Sometimes you don't need your phone. A lot of the time you do need your phone. I grant that, for work, you know, etc. But sometimes you don't. I think just treating these substances, you know, not substances, but treating these devices.
So it's good as a substance.
Yeah, well,
times,
they it's very similar. There's a brilliant book on all this called Dopamine Nation, which is by a psychiatrist that kind of, she talks about a much kind of wider version of definition of what a drug is, and within that she would include you know, social media and smartphones alongside other, you know, forms of addiction.
That's called Dopamine Nation.
Dopamine Nation, yeah, I would recommend.
Always after a new book, mate. It would probably terrify me, to be honest. But I think I'm well and true. Like, one of the questions I want to ask, actually, just from a personal point of view, the rise of a lot more people, or seems to be that more people than ever before are getting diagnosed with ADHD. Now, I went through school. I was very fortunate, I think, because I'm one of the last generations to go through school without social media, without smartphones. I didn't have my first mobile phone until I was about 16, and smartphone, probably early 20s.
Yeah.
Didn't really get into social media myself due to jobs that I was doing until probably closer to 30. However, currently, I am heavily involved with smartphones, social media, all that kind of thing. Far too much.
Sure.
There's another point I'm going to make that leads on to what you just said about going for a walk. But what interests me is, having studied psychology and neurology and knowing about things like neural plasticity and the fact that you can change your brain patterns, thought patterns, and that there's growth there. Can you develop ADHD through what you're exposing yourself to in terms of social media and concentration spans and things? Because I 100% think that my own attention span has been greatly reduced due to heavy use of the apps.
Yeah, it's a great question, and short answer is I don't know, and I'm definitely not an expert on ADHD, but I think with all diagnoses in general, but especially within mental health, right, these are spectrums, and at some point a psychiatrist or group of doctors somewhere has said this now becomes a diagnosis. You now have ADHD, you now have anxiety disorder, you now have depression, you now have OCD, whatever it might be. And I think it is useful to remind ourselves of that these are probably spectrums of human behavior. Because I think sometimes the problem with, you know, being labeled by something is that we, you know, feel that we can't improve, that we can't change, and we become a bit fatalistic. So it's just, I think it's important to be a bit flexible with those diagnoses sometimes.
Yeah.
You're right. The level of ADHD diagnoses has massively increased, alongside anxiety and depression as well in children as well. And some of that, as you said before, is probably due to increased awareness. Some of that probably does track social media use and the advent of the smartphone and things like that. I think, yeah, ADHD is a really interesting one, because it does seem like, you know, a lot of people are being diagnosed with it nowadays. And I think for some people that's really good. But as you say, I think for some people it's probably to do with how we live our lives now, you know, and if you spend, you know, all your huge amount of your attention on this small device, you know, people are on it several hours a day. And you're getting used to being kind of highly stimulated. So when you're then not on that device, you're kind of craving that stimulation, and it does massively, you know, impact your abilities to concentrate on things, and especially with like, very short form videos and like scrolling through and,
Yeah. You're so right, mate. Honestly, while you were saying that and you were talking about going for a walk, and I thought, shit, I do that. Like, if I'll do try and take myself out for a walk, but I will always have a phone, and I guarantee at some point on that walk, I'm scrolling while I'm walking, so I'm not really enjoying the walk.
yeah,
And I don't know if you noticed, but I've got two phones.
yeah,
So I've got a business line and a private
yeah,
line. And initially, when I first got the extra line, the thought was that I was going to have one phone that was, and to be fair, my private number very few people have got,
mm.
because what I was finding I was doing was, sadly lost my dog last year, but
Oh,
used to go on a lot of long dog
yeah,
walks. But I would take my work phone and I'd walk and I'd be responding to emails and
yeah,
social media and all
yeah.
this, and I'd do the whole walk. I'd be out for over an hour, get home and think, oh, missed the whole thing.
Interesting. Yeah, yeah,
So I got another phone and I didn't install the social media apps.
yeah. That's great.
And I kept it, but there was still, the reason I got that second phone was because there's still that weird attachment anxiety of I need to be contactable.
So that's the and how did people survive 20, 30 years
Yeah,
ago? Do you know what I
exactly.
mean?
Yeah,
And
yeah.
I remember talking to my dad about that, and obviously no one had phones,
No.
and but they would, everyone would meet up at the pub on
Yeah.
a Friday, and some of them might have a landline, and you'd ring, and they all got by, and I think
We did get by before
we
mobile
because
phones.
these
Yeah.
are addictive things, we trick ourselves into thinking we need them for absolutely everything. An example of this is when you say, don't have your phone in your bedroom, which is like a massive thing for me.
Okay.
There's a load of evidence that scrolling your phone before bed, the blue lights, increased stimulation, etc., massively impacts your sleep.
In
And
what way? Like, can we
so
expand upon that? That's
yeah, so
interesting.
obviously you've got different cycles of sleep: REM sleep and deep sleep. I think it particularly impacts REM sleep, which is a particularly restorative component of sleep.
Okay.
And you take longer to get to bed as well. And there are lots of studies looking at brain scans and people that have been exposed to blue light and smartphone use before bed, and evidence it does impact your sleep in a negative way. And in general, I think the thinking is you kind of want to. I mean, Matthew Walker, he's the sleep specialist. Talks about this a lot.
Yeah.
You want to be winding down before bed, so you want to be thinking about decreasing your stimulation. So that's with lighting, it's with noise, it's with activity. You don't do a hour session in the gym and then go to bed straight after that. It's going to be difficult. You don't likewise, you're not doing a big social thing and then going to bed straight away. You need this kind of wind down period ideally to support your sleep. And then also just back to the point about the tricks that we sort of tell ourselves. People will say, I can't not have my phone in my room, it's my alarm clock.
Yeah.
But then what about alarm clocks? You can get a you can get a £5 alarm clock online, probably even less than that. So it's not. It doesn't cost much.
I'll be honest with you, Henry.
That's how we woke up. Yeah. Originally we would wake up with natural sunlight, and that's the most ideal way. But we can't necessarily do that nowadays all the time.
I tell myself all the things that you're saying. No, I do exactly that. I'll be honest. My own life, I do take my phone to the bedroom. It's on the bedside next to me, which is probably the same story for most people.
Yeah.
While it's on charge, and that is my alarm clock.
Obviously no judgment with it. That's just my preference. I think it's kind of evidence informed. I'd recommend people trying it out, and also being prepared for the anxiety that will bring, because I think these are devices that a lot of us have an unhealthy relationship with. There is addiction elements involved, and so as with a substance, if you're coming off that substance a bit more, there's going to be a bit of withdrawal. There's going to be some anxiety. When you go for that walk without your phone, you're going to feel almost kind of empty. You're like, what is this? Because we're used to them being, a part of us. And it's the same with going to sleep without it. It does bring with it an initial amount of anxiety, but over time, you become much less anxious. You're more present. Hopefully, with the bedroom thing, your sleep improves a little bit. If you're going out, for a walk in nature, hopefully you look around a bit more. You're present with your thoughts more. I mean, being present with your thoughts is such a vital thing for mental health and personal growth, isn't it? You know, if we're not
Mm,
present with our thoughts, how are we kind of processing what's going on in our life and things like that? Because of smartphones and our, you know, often unhealthy relationships with them, you know, when the thoughts come in, we're like, oh, yep, no problem. I'll just have a quick scroll and I'll just do that thing. And, you know, it's this kind of distraction in a way, isn't it? So
yeah,
we've lost that kind of ability, some of us, to just be bored, you know, with our own thoughts.
to
And
just be.
yeah.
It's fascinating, mate. It really is.
But also, I really struggle with this as well. So I don't want to say that I'm, you know, I've got
No,
it,
no,
got it all down. But
Henry,
I
I'm
think there
exactly
are,
the same. I'm probably of exactly the same opinion of you. I've said a few times that one of my own, it's a bit of a morbid fascination, really, but is the new generation of people. So as I say, I was probably in my early 20s before I got a smartphone.
mm,
Is that new generation now that are coming through that were born into it? So
100%.
right the way from childhood, they've been given the tablet,
Yeah.
they've been given that stimulation, that
Yeah.
short fix from essentially from birth.
100%. Yeah. And I think I was kind of borderline of that. I think Facebook and all that were coming in when I was a teenager. And whereas
Mm.
my little sister, who's 10 years younger than me, she very much was, you know, did grow up with it. I mean, my parents were quite restrictive with screen stuff. I mean, you've got, you said you got kids, don't you? Or
Yeah, so my son's he'll be 18 in a few weeks'
okay, fine.
time.
So they
My
kind of have
daughter's
grown up in this era.
well
I
and
mean,
truly in it. Yeah.
how did you, as a dad, kind of cope with that? Were you quite liberal? Were you
Look, yeah.
restrictive at all? Or
I what I would say, Henry, is with my son in particular, I tried to keep him off
mm,
things, and it was a battle
mm,
because then you expose them a little bit. And there's a few problems with being a parent, a few difficulties in that you end up, you almost become like the jailer
mm,
because all of their friend circle at school are all doing it. So then your child's coming home and going, oh, mom, dad, can I have this? Because
sure.
all my friends have got
Yeah.
this. You know, they're all on this game, okay, Minecraft was
Yeah.
one when my
Yeah.
son was little. Oh, my friends are all playing Minecraft.
Mm,
So then you give it a little bit, and then a
mm,
little bit needs to be more. And I
mm.
attempted to limit it, but there were definitely times, if I'm honest, where as a working parent, I would be tired, and the easy thing for me would be like, "I'll just go on your tablet."
Sure. Sure.
I had certain places where I would not allow it,
Mm,
like in terms of I see families now. I go out for a meal,
mm.
and the whole family are sat. You'll have two kids on the tablets, mom and dad both on the
I
smartphones
know.
for the whole thing. Now, I was always one with my kids when they were little. If we're going out to eat, we're going out to eat. There's no tablets, no
I think
phones.
that's great. My brother does a game where if his mates go out for dinner, they all have to put their phones in the center of the table, and the first one to
Pick it
reach
up
for it
has to
has
pay.
to pay the bill or
Yeah,
something
yeah,
like that. So
great, love it.
I think that's such a good example. You know, if you're doing a particular
Mm,
activity, you want to be doing that activity for that reason. You want to
yeah,
be you're going out to dinner to connect with the
yeah.
people that you're having
And
dinner with.
look,
You're going out for a walk in nature to connect with nature. It's very easy for
mm,
you know these devices to quickly kind of
and
take over
it's
that.
no judgment, Henry. I mean, on the
No,
other side of that, I know parents are very busy, and you might have mom and dad that actually, do you know what? They haven't seen each other all week. They want to go out together, and the kids are playing up, and it's easier to put them on
sure,
tablets so they can get some time together. I
sure,
get that. There were just certain things, I guess, certain boundaries that I personally had in place. I haven't had the same level of control with my daughter because
mm,
me and my ex-wife split up, and my
mm,
daughter lives with my ex-partner.
mm,
But I don't. No, she is on her phone a lot. I'll be honest. But
mm,
with my son, I guess for me as a parent, I kind of had key markers where I was like, you know, he always loved playing football,
mm,
so he had his
mm.
social activities with stuff like that. So I kind of thought, okay, well, he's okay. It's little things as well, like when we used to go out for meals, I would always make sure that the kids had to order their own food.
Yeah,
You know, I would never do it for them
yeah,
to make them present, get
yeah,
them involved. And it's little things like that they've kind of evolved as people because of that social stimulation
yeah,
that some people don't get now.
yeah, yeah.
But it interests me, as I say, kind of morbidly as to what this is going to produce and
Mm.
the amount of
Well, it's a social experiment, isn't it?
it
These things that
is,
we've
yeah, yeah, yeah,
put out in the world, and
for millions and billions of
it's only
people.
what, you know, 15, 20 years old, the advent of the
Yep.
smartphone, and the main difference is that these do everything and they go
Yeah.
everywhere with you. You know, before then you might have had a computer
Yeah.
in the home or a landline. It's kind of set in a very
And
particular space.
and listen, I mean, age doesn't come into it either. I was in London a couple of weeks ago doing a public speaking event, and I got the tube home, and I'd got some headphones in. I was listening to music, so my phone was in my pocket. I got on the tube and I looked up, and it was packed. Not one person was paying any attention to any. Everyone, every single person. You're talking people from 70 down to 17. All heads down on their
dystopian,
phones.
isn't it? I mean, if someone was to
Crazy,
look 50 years ago, was to see a picture, they'd be like, "What is going on here?"
100%. But it is a fascinating experiment, really. Unfortunately, I don't think it will be a positive one. I can imagine it will serve to increase the likelihood of things like, social anxiety, for example.
I think people are becoming more aware of it as well. I think you see things like the Australian government put a ban on, I think it was a ban on certain social media use for children under 16 or something, very radical thing.
I hadn't
But
seen
I
that.
think, you need stuff like that because our brains are developing as children. They carry on developing till we're 25, don't they? So we need to be really careful with these devices. And I think just treat them as addictive things that they are.
Interesting. I can see you've got some passion there. Do you know what? Before we go too much further, Henry, what I want to do, because I know pre-record we were talking and you were saying you've had your own experiences around mental health and your own situations. Can we delve into that and sort of, talk about what you've gone through on a personal level and then how you've come to be where you are today?
Yeah, of course. So I guess growing up, I was always impacted by mental health without really knowing it was mental health. I had a lot of strange habits that I still kind of do now. I used to have verbal tics and movement tics. So certain neck twitches and sounds I would make and things like that. And I would often have to do these things, or I felt like I'd have to do these things a certain number of times. And it was very noticeable. I mean, this was just part of my everyday existence. For
what age was this?
Honestly, as young as I can remember, 7 or 8, that sort of age. Parents had me, taken into doctors to see what was going on. I remember getting given a whale music tape once, which was supposed to help.
Whale music,
bit of a weird one. But anyway, so I had all these habits. It was diagnosed as OCD growing up a couple of times. I think looking back on it, it was more and is more because I still have these kind of tics sometimes. It's more of a kind of tic-based disorder, but it's a classic example of, not everyone can fall into a particular box with mental health. And I think the reason I don't really think it was OCD was because I never had obsessions. I just had certain compulsions that I felt I had to do, and I'd feel better after doing them. It's quite strange. It's something that I'm really accepting of now. I don't have any shame over it, but it's interesting. And for me, it's that thing of, what has caused that? Because I don't necessarily think there was, necessarily a cause in my childhood that caused those tics. I've had them for as long as I can remember. I think, maybe there was something genetic going on. Maybe I have some excess dopamine floating around in my brain.
Okay.
I don't know. So that was kind of one thing growing up. And then went to medical school and had my first experience of a kind of anxiety/depression period that lasted a couple months, I think triggered by a really fun kind of first year at university, but a lot of, partying and sleep deprivation and not necessarily looking after myself, and a lot of social anxiety that comes with, the remit of first year at university. I was in a big hall filled with 500 strangers, and it's very social, and it's a lot. And I had a really bad period at the end of that year. I remember kind of hiding myself in my room. Felt like I couldn't see anyone, and went home to family and then told them what was going on, and then saw a GP. Was lucky to have an amazing GP who really understood mental health, and I was referred to some group CBT therapy, which was reasonably helpful. I was actually started on antidepressants. I've been on antidepressants a few times in my life.
Mm.
I'm not on them at the moment.
What was your experience of that like? Were they helpful?
I think they were helpful in the sense of feeling like I was doing something to support my mental health for the first time. I was both being proactive with therapy, and I was being proactive with, in this case, medication. And I was talking to people. I was talking to my family.
Mm.
I have a great family, and they were, they were really supportive. And I had good friends who were supportive friends who I hadn't necessarily shared what was going on, but I did then, and all of that was kind of part of supporting myself. I think the medication helped the lows be slightly less low, and I think they played a role. I wasn't on them particularly long that time, but that was the start of my mental health journey, kind of consciously, I guess, and that led to me just starting to have a real interest in mental health and the relationship of mental health and physical health, and how it related to my job as a doctor and medicine in general. And then I've just had a couple other periods like that, of prolonged depression, when I've sometimes needed, or had medication, and I've also had one-on-one therapy occasionally in the last kind of 2 years, which has been really helpful. So yeah, just a number of different kind of. I think for me, as with everyone, there are triggers, and then combination of triggers, and then also maybe not looking after myself as well as I could be,
Yeah.
lead to, uh, you know, led to
More
mental health
prone.
periods.
Yeah,
And
yeah.
not everyone has that. I mean, I think there's a potential for that within everyone, but not everyone has that as easily. They talk about I think it's the 3 Ps in mental health. Let's see if I can remember them. So there's precipitating factors, um, perpetuating factors, and protective factors. Okay.
Okay. Can you explain
So
that for us?
precipitating factors might involve things that have happened in childhoods, that, make our mind work a particular way, and cause certain thinking patterns, based on what we've learned as children, but don't necessarily kind of serve us in adult life. And also within precipitating, just genetic as well. Like, everything that we experience is a mixture of genes in our environment, so that there's going to be a role there that is out of our control as well, that we might just have certain biological kind of propensities towards certain conditions. And then perpetuating our, things, and things that, continue, poor mental health, factors in our life that are kind of not supporting our mental health, whether that's, an unhealthy relationship with substances or sleep deprivation or not eating properly or whatever it might be. And then protective factors, are just, the protective factors for our mental health. And we, everyone learns what those factors are, and it's kind of about, implementing them, and it's kind of personalized to each and every one of us. So I think those periods have just, have massively informed, my passion, I suppose, and also just kind of learning, about myself and kind of self growth and things like that. I've read countless self help books, I suppose. I would never have called them self help books, because I, that word has a kind of stigma to me, self help, for some reason. But
Yeah.
and they were often, psychological books, or more academic books or whatever. But they were effectively, ways of trying to understand mental health, understand my mind, understand why I was feeling the way I was feeling. And I'm a big advocate for those types of books. There are a lot of good ones out there.
Got any that you'd recommend?
Yeah, so lots, but I mean, in terms of kind of starting ones, something like Finding Peace in a Frantic World is really good, which is
Okay.
a mindfulness based book. It's written by one of the doctors or psychologists that brought mindfulness based therapies to the UK. So mindfulness is effectively, a westernized kind of meditation practice, isn't
Yeah,
it?
yeah,
With
yeah,
roots in Buddhism
yeah.
and in practices in other parts of the world, and that was brought over to America first through John Hopkins University and Harvard by a guy called John Kabat-Zinn, who's a bit of a legend in that field, and then someone called Mark Williams and others in the UK, in particular Oxford University, brought that kind of mindfulness-based therapies over to the UK, and now they're kind of readily available in the NHS. And this book is written by him, so it's one of the Mark Williams and one other person, I think. So
I'm going
it's
to be playing this back myself to get my own book
right. Well,
recommendations. So I
GPs recommend
appreciate
that
it.
book. It's very evidence-based, and you kind of work through various mindfulness exercises, but it's also just a lovely read about our minds and our thoughts and things like that.
Okay.
6 Minute Journal is a great book for doing a 3 minute journaling practice at the start and beginning of every day. It's all got prompts for you. It does all the work for you. You just have to fill it out. Nearly everyone, hopefully, has 5 minutes spare in their days. We can find that, and that's a really helpful kind of book to help improve our relationship with our thoughts and kind of challenge kind of negative thinking and things like that. Great book I read recently called The Happiness Trap, which is by a former GP who was one of the big names in acceptance and commitment therapy, which is a really great form of therapy that emphasizes kind of acceptance of our feelings and all our feelings, including the negative ones or the ones that we label negatively. And yeah, that's a really great book. Can send you over some others, but I found
that's fantastic, Henry. I haven't listened to any of those, so I'm always. So one of the reasons I started a podcast is obviously working in construction. I'm quite solitary a lot of the time, so I found that listening to either podcasts or audiobooks gets me through the day.
Yeah,
I think it to a degree it tricks my mind into thinking I'm not alone. So because I've got voices in my head, and particularly some podcasts, you can almost feel like the third or fourth person in the room just spectating just through having that human interaction, I guess.
100%.
Yeah. So yeah, I'm always looking for new audiobooks to stick on, and at the end of the day, some of the tasks that I do now are quite automated, I guess. I've been doing the job a long time, so it doesn't engage the mind. So it's nice to, if I can be physically completing a task that I've done 100 times, I can also be learning something new at the same time.
Sure.
So,
and they're not, these types of books aren't for everyone, but I think if you're someone that likes reading or listening to audiobooks, as you say, it can be a really great way of it kind of giving ourselves the tools to support our mental health alongside other things, like talking to friends, getting professional help, medication, etc.
No, that's great, mate. I appreciate it. What I'm going to jump into now, because I think it was 2 hours before you were due to arrive today, I put a clip out on Instagram, said you were coming. I said, look, if anyone's got any questions for Henry, send them over.
Here we go.
And people did, surprisingly. I think today's Sunday, people are obviously lay around or stood around with not a lot to do. So I have them in my notes. I'm going to fire some questions at you, mate. There's nothing that I think you'll find too taxing. However, all questions that people have sent in. So, first one, which I thought was quite prominent, what is mental health?
God, what a simple but great question. I take a very broad view of mental health, which is just, it's how we're feeling from second to second. It's the health of our mind. I don't fully medicalize it. I think sometimes when people hear mental health, they can think we're just talking about mental ill health or mental illness or it's just this kind of thing. But actually, we all have mental health, don't we? It's literally just how we're feeling from second to second, from day to day, from week to week. So I think that's the main thing I'd stress there, is that it's it's what's going on in our head. We all have it. Sometimes we can have periods of poor mental health. Sometimes we can have such poor periods that it becomes a condition, or fit particular boxes in mental health categories where it becomes a condition. But yeah, my view of it is that it's something that we all have.
I think that's just fact.
Yeah, 100%.
I think literally every living person on the, well, I don't
You
think I
used
know.
to hear
Yeah.
people, and maybe it happens less now, but you definitely used to hear people say, "I don't have mental health,"
Yep.
and that they mean by that, I don't suffer with my with poor mental health, and which is slightly different. But also often those people
I was
still
one of those
did.
people,
They
Henry.
just had kind of denial over it. If that makes
That
sense.
would have been me prior to 30 years old. That would have been me.
Yeah.
And that would have been my stock response. If somebody would have said, "Talk to me, Russ, how's your mental health?" I'll be like, "Yeah, sound, I haven't got it, mate."
Yeah.
That would be me.
Yeah,
Haven't got it.
Sure. It's interesting.
But it was lack of knowledge, lack of understanding.
Sure.
I mean, I'm 40. And obviously you only know what you're taught.
Yeah.
And there was, the generation above me. So my father, very traditional, that generational thing, the stiff upper lip,
100%.
man up generation, wasn't talked about. It was hidden. So I was never educated around mental health. I never remember a single conversation around mental health. There were sort of like, I guess, trauma points in my life that I went through. And I don't ever remember any of my parents or anybody, my peers, saying to me, "How are you feeling?"
No, I mean, it's fascinating that, isn't it? Because that's massively shifted in a broadly positive way, I think. But even for me, I'm a bit younger than you, but not much younger.
You look a lot younger, so I need to get the skincare regime.
It was the Nivea moisturizer. It was the same for me at school. There was no mental health kind of education really at all. My kind of learning on that came through books and through my own experiences in my kind of late teens, early 20s, and through my work and research as well. I think you said, coming onto the man up and stiff upper lip thing, I think it's something that women have done broadly better than men, I think, over generations, simply because on average, women are better at talking about their feelings and sharing those feelings with their friends, and that not being seen as a weakness. Whereas unfortunately, we've got this really horrible historical philosophy in the UK and some other countries where men are taught to believe that vulnerability is a weakness, and I still see that play out with many patients that I come across, and I think we need to completely flip that, don't we, and say actually vulnerability is a strength. And my argument for this is that if it's hard to do, it's probably a strength, right? So you're doing your amazing climb up a mountain soon, aren't you? So that's going to be hard.
A climb from darkness.
It's going to be hard to do, isn't it? So it's requiring strength to do that. So if opening up about your feelings and sharing what's really going on, trying to share what's really going on, because sometimes people don't really know or they don't have the words, but trying, if that's hard, it's probably a strength, isn't it, to be able to do that and to learn how to do that and practice doing that. So I think if we framed it like that a bit more,
I love that,
towards men, we would sort of get people on board a bit more, like kind of play us at our own game in a sense, actually say, no, it's the complete opposite.
But it's true. It's true.
It is true.
And again, one of the big problems with my industry, being the construction industry, is it's pretty much dominated by your more stereotypical alpha male types. And it's one of the big problems.
Which is why I think it's so good that you're doing this podcast. And I've seen lots of patients who work in construction, and obviously not all the same, but there's certainly a truth to some of that stereotype and some of what you just said. And I've seen people get help for their physical and mental health far later than they should do because of the stigma and these views that are just so ingrained in a lot of people that asking for help is not what you do, and a weakness, etc. And you see that across pretty much every physical health condition. men have poorer outcomes. And most of this is to do with health behaviors in some way. So whether that's increased risk-taking behaviors, or asking for help later. So things are found later and, you're already quite unwell by the time you're presenting, things like that. So it's a major problem, and it's something that I'm, very, very passionate about. And we should, we should be thinking a lot about kind of
It's a
male,
great
and then
answer, mate. Yeah.
that's physical health, and mental health. As men are 3 times more likely to die by suicide. They tend to attempt suicide by more violent means, and it's just something we need to. It's what why the podcast is, I think, is so good, because you're.
Well, the latest statistics on top of that, so obviously men in general are 3 times more likely to die by suicide than women, but men in construction are 4 times more likely than the national average by industry.
Yeah, there we go. And I think, it'd be interesting to know what you think the causes of that are, but I'm sure it's quite a male-dominated field. Am I correct in saying?
It's male-dominated, Henry, but there's a few. So I've had really great insight through doing the podcast, because I've sat down with a lot of people in construction and a lot of people, some of my former guests that have got to that point, whether it's thoughts or actions. And there are certain things that repeatedly come up. One of the main ones is a lot of isolated working. So 2 of the worst affected trades in the industry are decorators and plasterers, who are the finishing trades and most likely to work alone. So there's a lot of isolated working. I've experienced that myself. But there's a combination. So you've got high rates of isolated working. You've got nobody checking in on, so there's no HR department.
Sure.
So people, particularly as self-employed, can go out and do 100-hour weeks with nobody checking in on them. You've got, if I'm honest, work hard, party hard culture. There's a big drug and alcohol culture around the construction industry, and that's just truth. And you combine all this stuff and money insecurity as well. Financial comes up very, very often. So again, within the self-employed sort of world, as it were, there's no such thing as a regular payday. People quite often will be victim to larger companies going bankrupt, and then they might owe out people. If you're a mid-level contractor, it's quite a tricky position, because you will be contracting to somebody above you, and no doubt you're paying out regularly to your subcontractors below you.
Interesting. So it's clearly very complex, which is when you've clearly thought about it a huge amount, which is amazing. And I think because it's complex, it's then even more important that you're doing what you're doing, but also just people within the industry are talking to one another and checking in and acknowledging the difficulties and complexities of the work that, coming back to kind of precipitating and perpetuating factors for poor mental health, right? And I think it's also just changing our culture around this, this sort of cliche that, women talk more about their emotions, men talk about things, it's sort of true a lot of the time for a lot of people. Personally, I've always been towards the more feminine side of that, and that I love talking about feelings and emotions and things like that, and I've been that way for a long time. But that's not the norm among men is still towards that. And part of that is great. It's still bonding to to talk about football and talk about video games and what you did last, whatever it might be. But I think we need that other side as well, of just kind of little check-ins,
The balance.
and not being. I think people can feel like they, maybe especially men, because we're wired in a sense to feel like we need to have the answers and to kind of fix things and have that. I'm sure, especially in construction, right? We're literally fixing things all the time. So people are probably wired to have that belief that they need to have the answers. So maybe people don't ask so much because they think, oh God, I don't know what to do with this if I hear something that I don't know how to fix. And mental health can be a bit complicated sometimes, but actually you don't, we don't have to have the answers. And I'm so guilty of this so much of the time, thinking that I need to provide the answers to someone that's come to me with something. Actually, a lot of the time you just need to validate that person and listen a little bit and hold space for them. My partner told me another acronym that I loved, which it's not an acronym, but a phrase, which is if someone comes to you with something, or you think they might want to share something going on with them, or they do share something going on with them, you can ask if they want to be heard, helped, or hugged. And I loved that. Heard, helped, or hugged. Because sometimes having a framework of knowing how to support someone can be really helpful, because sometimes they don't want an answer. They don't want to know what you think the right thing to do is. They just want to talk and then be hugged, or they just want to be heard. Or sometimes that person does want advice or a tip or your thoughts. So I like that, because it's making it about the person who's opening up, rather than
It's a great tip.
your own
Absolutely, mate. No, it's great advice. Great advice. We'll get on to the next question.
Go.
Where are we? Because there's a few. So
Sorry,
the next
long
question
answer.
was, what's the best way to approach somebody that you think might be struggling with their mental health?
That's a really good question as well.
So I can only imagine that it's, third-party framing, isn't it? If that's a partner, a friend, or somebody that you're looking at and thinking you're concerned about, but how do you bring that up?
Just think about that a little bit. I think it's going to depend on the person and how you think they're going to respond. But I think just doing it first and foremost, however that looks for you. It might just be to ask for some one-on-one time. Do you want to go for a coffee? Do you want to go for a walk? You can do it over a phone call if you want, but I think, in person is normally better. And then I suppose you can just ask with a broad question, how have you been feeling recently? And you can say, I've been noticing this a bit, and, never be kind of accusatory of it, but just kind of keep it open and just saying, how have you been recently? And you can even say, I've been a bit worried about you, and I just wanted to express that. And then you kind of take it off them a little bit. And, if they're a friend to you or a family member, they probably in a way care how something's impacted you. And so they might,
Nice.
respond to that.
Answer,
but then
Henry,
I also think, don't be afraid of, what the answer is going to be. And then also, if they do just say they're absolutely fine and everything's okay, and you can kind of tell that it's not, my opinion would be that you don't necessarily take that for an answer. If you feel you have capacity to gently push a little bit more with compassion, then I try and do that, because I think we're all very used to just saying I'm fine, or things, or
I experienced this myself. So around about, and I won't go into too much depth because it's something I've talked about previously, but my sort of like mental health awakening centered around me going through a divorce and all the stresses and pressures of court cases and all that. It was actually who is my now wife, who I'd met, and we got into a relationship about 9 months into the whole process after the previous split. But it was actually her that first noticed in me mental health situations, I guess. Essentially, I was struggling with anxiety around what was going on. All quite normal, to be honest, with what was happening. And maybe a couple of borderline panic attacks. But I was quite... When she first brought it up and said, you're looking like you're suffering with anxiety, or words to that effect, I was very, nope. I was quite... I wouldn't say I pushed back forcefully, but I was very dismissive of it.
Sure.
So no, I'm fine.
Yeah.
But what that conversation did was plant a seed.
Yeah.
And it actually took me, and that's maybe more me than anything, but it took me a few days it planted the seed. I pushed back and said no, but after a few days, I started actually evaluating myself and thinking, actually, maybe, and then looking into various elements of like the physical manifestations of the stress and just stuff like, well, actually, when my phone goes off, heart rate's going through the roof and that, because I'm thinking it's a message or an email from a solicitor or whatever it might be. So it did take me personally a few days to process it.
Yeah, that's so well put. And I think, you might not get the, positive response that you might, think about, when you first kind of approach someone, but you're not doing it for you, you're doing it for them. And as you say, I think sowing the seed is a really good way of putting it. We have to try, don't we? We have to check. We
Absolutely.
have to check in,
Yeah.
because unfortunately, not everyone does, or people assume that other people will, or people assume that people would reach out to us, and unfortunately, that doesn't really happen. And I think stress manifests itself in different ways, doesn't it? And especially among men, but among everyone, people can think that they're not stressed, but actually it is coming out in different ways. They're getting angrier more, they're losing their temper a bit more, they're doing certain behaviors that are unhealthy for them, and they might not mentally be thinking, oh, this is stress right now, actually.
Yeah.
It's just coming out in certain behaviors.
Yeah.
But I think, as you say, you've gone on that journey with kind of your own mental health knowledge and awareness, really, because part of it is just being
completely unaware.
aware of the fact that we all have mental health, knowing what our triggers are.
It was a true light bulb moment for me, because I went 30 years completely ignorant to it. So then all of a sudden it was like, wow, okay, now I'm fully behind that this is a thing. So now I need to learn and educate myself and gain the knowledge around it.
Absolutely. And it's emotional intelligence in a way, isn't it? We're not really taught that growing up as such. We kind of all learn it in our own way. But having an active brain, if you're suffering from anxiety or something like that, it's a strength as well. If you're someone who's, inverted commas, an overthinker, although I don't love that phrase, you're probably someone that is, you might be quite empathetic, you might think more about other people. It has its issues, because maybe you do overthink certain things, but it's a way of kind of accepting that and getting control of that quite active brain, and then it can turn into being something that's quite positive, I think. But yeah, it starts with that kind of mental health awareness, and as you say, maybe some of that starts with just a conversation with someone, checking in with someone, and that person may well start going on their own journey with that.
Fantastic. Again, great tips. Where are we? Next one. Okay. How long does it take to improve your mental health? That's a little bit of an open-ended question, isn't it? But I mean, if we try and put some context on it, so I'm assuming if you were at a point where you recognise that you were at a low point and were to take action.
Yeah, I think obviously the answer to the question is going to vary from person to person. And I think, part of the answer is just to start. You don't know how long it's going to take before you start feeling better, but there's, no way you're going to start feeling better a lot of the time unless you kind of do take action. And that starts with awareness and acknowledgement, and just accepting of where you're at the moment. A big part of acceptance and commitment therapy is about that first step, and it's very evidence-based kind of therapy. You accept where you're at regardless of how you're feeling, and then you commit to effective action that's in line with your values over time. So yeah, it's a lifelong thing as well, to be honest. Like, I've had lots of periods of bad mental health over the last kind of decade, and I'm learning more and more about myself. I'm sure you are as well. It's okay for it to be a lifelong thing. Like, I've really enjoyed learning about my mental health and learning about what works for me and what helps me and what my triggers are, and doing all that with compassion for yourself, and trying to just have no shame with how you're feeling, because we can't control how we're feeling. The thoughts, whether it's depressed thoughts or anxious thoughts or fear or whatever it might be, we can't control the thoughts that are entering our brain, but we can try and control our response to those thoughts, if that makes sense, rather than judging the thoughts that come in.
Well, the next question is an interesting one. I think I've seen one of your videos, so I think this person possibly has done the same thing, because the question is, if I am not my thoughts, what am I?
It is a great question. There's been some really good books written on this area. one of which is called The Untethered Soul, which
That sounds deep.
it is quite deep. It gets a bit too deep and a bit too spiritual for me towards the end, but it's a really interesting book, and it answers this exact question, because that can feel a bit scary. If I'm kind of saying we're not our thoughts, and often you hear in meditation we're not our thoughts, then what are we? So in my opinion, if we're not our thoughts, we're the kind of observer of our thoughts. Okay, so everything kind of has a, hopefully this doesn't go too airy fairy, but most things have a subject and object relationship in life, right? So we're, with our sights, for example, like we're viewing that object over there, I'm viewing you sitting here, so I'm the subject, you're the object in that example. Okay, or the table's the object and I'm the subject. I kind of view thoughts in the same way. Thoughts do just enter our brain. If you were to lie on the sofa and I say to you, don't think of anything, are you going to manage that? Probably not. Equally, if I said don't think of an elephant and you try really hard not to think of an elephant, you're going to end up thinking an elephant, even though you're not wanting to think about that. So we don't have as much control over thoughts that enter our brains as we think, which can sound scary, but we can observe our thoughts, and things like mindfulness really help this, because it helps us actually see that we are a bit separate to our thoughts and we can detach from our thoughts a little bit. Because what happens sometimes when we get really anxious or depressed is that we are doing what's called fusing with our thoughts. So we're kind of believing all of them. So let's say you have a repeating narrative, with you, that you're not good enough, at XYZ, or you're not interesting enough, or this kind of enough thing, which affects a lot of people. Thought fusion, you're fusing with that and believing that, whereas actually that's just a thought. It's a common thought that enters your brain, and it might be difficult to deal with, but you're the person who's observing that thought. So hope that kind of makes sense. That's how I kind of look at it, and I think that's what meditation teaches you, is that you're the observer of your thoughts, as opposed to every single thought that enters our brain. Does that make sense?
It does. On a personal level, I remember I listened to a book by Eckhart Tolle, The Power of Now.
Yeah.
Do you know it?
Yeah, I do know it.
Have you listened to it on audio?
I haven't actually. No, okay. I read it many years ago, and it's kind of up
on
that
audio.
Street.
I would recommend anybody listens to it, just try and get past the dinging of there's like somebody hitting I don't know what those things are called, like cymbal kind of noises. And he's very because I think he narrates it himself. Obviously, very spiritual chap, and
can be a bit too much for some people, I suppose. Kind of,
but the messages within are incredibly profound. And it was in that book they go into quite early. The explanation that I found really helpful was being at one with yourself, and the fact that if you're not at one with yourself, then there must be two, and obviously two can't live within the one. So that self-observation of you not being your thoughts and observing your thoughts, it's a strange one, because then I kind of think, the way my mind goes, I think, well, if I'm observing my thoughts and passing judgment on them, then there's somebody else passing judgment within.
Yeah, but to judge, in a sense, there's a kind of thought going on there as well. But the observing self is non-judgmental.
So would you just be passive in that moment? But what I mean by that,
it's just observing. It's like when you're looking at the clouds in the sky and they're passing, and you're just kind of watching them kind of go past. I mean, listen, like, these are kind of principles and theories and ways of living that we kind of strive towards, and I think it's not about being purist about it, and it's not about going so far in this direction that we can feel a bit kind of
well, we're predetermined to be negative as well, aren't we? I think just generally as most humans are predetermined to be negative.
Such a great point. Like, it's called the negativity bias, isn't it? So we're more likely to believe the negative stories that enter our brain, and we were wired to do that from an evolutionary point of view.
Yeah, because that would have been too
somewhat if a lion attacks you, it's a pretty and you escape, it's a pretty important thing to remember. And
so it would be, I mean, a good example of that, if you're in the jungle, the bushes are rustling, you're more predetermined to think, God, it's a bear, rather than it's probably a
It's the wind,
friendly,
or whatever.
or it's some friendly creature that,
Yeah, 100%. You're more likely. We're more likely as humans to believe that negative story. That's the negativity bias. So acknowledging that and learning that, we can maybe be a bit more compassionate with ourselves about these more negative stories that enter our brain. And it's a good exercise to just think about what those negative stories are for you, and also just really trying to believe that they are stories and they are kind of sometimes, unhelpful thought patterns that at one point served you. They might have served you in childhood,
Well,
but then they've kind of outlived their purpose
there's a
in a
part of it.
sense.
So I spent some time reading books on like evolutional psychology, and there's a part of that that kind of explained it to me with the negativity bias, because our evolutional level, as it were, we're kind of evolved as a species to still have those things ingrained in us that would have previously served a purpose. But because today's society is so very different,
Absolutely.
and as a race of, well, as a human race,
Yeah.
we've eliminated a lot of
Sure.
the dangers that would have been that we've evolved to become aware of.
Sure.
So
but
now
we haven't changed, have we? So that's the key thing, isn't it?
So we translate what would have been, anxieties towards things like, God, is that a saber-toothed tiger, to other things in life that don't really equate to the same sort of thing.
But feel the same, right?
But feel
and
the
that's
same,
the whole, the thing with anxiety, or, certainly at the extreme sense of that, panic attacks. I mean, panic attacks can really feel like you're
they feel like heart
dying,
attacks,
I mean, so it still feels like that lion is chasing you on the savannah, even though that's not going on.
I'm not going to open the box fully, but which is another fascination of mine, that our culture and society is evolving so fast, like at a rate that I don't think has ever been known. With technology advancement, it is a fascination of mine as to how we're going to adapt into that. I had this conversation with a friend of mine where I basically took the point where I stood there and said, look, we're not evolved to live in the world that we live in. But his point, and I took his point, was, but we must be, because we created it. So how can we not be evolved to live in it when it's of our design?
Well, it's the pace, though, isn't it? It's the pace of environmental change with evolution. Evolution is reasonably slow, and the technological advancements in recent decades are going at an astronomical pace. So our brains have not evolved in that time, very much, really. They haven't really evolved much in thousands
10,000
of
years is roughly. But fascinating. Whole other subject, that one, Henry. We've got a few more questions to work through, mate. Where are we? Right, so we've just gone for the depth. This question, I would say, is very specific to the construction industry, because it's quite an issue. How do you recognise the signs of impending burnout?
Interesting. I mean, I'd love to hear from you about its relation, in the construction industry. Obviously, we're very aware of this in the NHS as well, and
probably similar.
Levels of, record levels of, GP burnout, for example, and so I think, I think I don't know, because it's a number of different things, but I think certainly when you're kind of not able to look after yourself in a way that you normally would, so that's with your sleep, with your food, exercise, things like that. If everything's all just feeling a bit too much and you don't even have enough time to look after yourself, that's probably a good sign of impending burnout, coming back to those precipitating or perpetuating factors for, a bad mental health period. So I think those are probably the big ones. What do you think?
I agree. Yeah, I think as an industry, we're probably quite similar. Very different, but in terms of burnout, it would probably be the same ingredients: long hours, unsupervised, long hours. So, as I say, generally, I think the self-employed possibly more than somebody that was in an employment role within construction, because like, I could do 80, 90, 100 hours next week easily. Nobody would check in on me. But then it's that spiral. So you've got that. There's a lot of one-man bands out there that do incredible work. And I've experienced this myself, where you've got the hands-on site work, which I see as the easy work.
Mm.
But then after work, you're out quoting, you're dealing with customer inquiries, you're dealing with any problems you might have. You might also be chasing money, so you're invoicing. There's just
So
a lot.
it must be an important thing in that space to create boundaries for yourself, right? In terms of how do you not let that seep
Well,
into absolutely everything?
yeah.
I imagine that's quite hard.
That would be important, and I think the reason that burnout occurs is people don't.
Yeah,
You
yeah.
know, it is a big problem in construction. And I guess what you're saying really is boundaries would be really important.
Yeah. I also just think it's that shift, which, um, not everyone has gone through in terms of putting your mental health as the very most important thing in your life.
Yeah.
And I really firmly believe that, over everything. And it's not selfish to do that. If you say you're going to put your mental health first in general, and you're creating the tools in your life to do that, you can support other people a lot better than you would have been able to otherwise. Sometimes people think that it's somehow selfish to kind of put yourself first, but I think it's a bit more like that airplane thing of
Yeah. Yeah.
what is it?
Put your own oxygen
put your
mask
own
on
oxygen
before
mask on.
saving others.
Yeah,
Yeah.
I think
Yeah.
so. I think so.
Absolutely. Self-care. Yeah,
Yeah.
absolutely. Next question. So this question was written in this manner: how common or serious are suicidal thoughts?
Yeah, thank you for the question. They're really common, actually. And if anyone listening is experiencing suicidal thoughts, I think just, you know, acknowledge that actually it is really, really common. It doesn't mean that there's, anything wrong with you or you're abnormal or anything like that. It's, part of the human condition that a lot of people feel this way from time to time. In terms of percentages, I'm not sure. So I'm not just going to chuck one out there, but it's definitely like very, very common, and important to not feel any shame about that, but also just to reach out for help. Um, you know, talk to friends that you can trust or family members. Go speak to your GP as well. Your GP should be very, very well trained in terms of supporting someone with those sorts of thoughts, and trying to support you with the kind of help that you need with
Yeah.
that. Don't kind of go through that
I refer
alone.
back to, I had on the early days of the podcast, I had a fascinating conversation with Dr. Susie Bennett, who did her PhD in male suicide research. And one of the points she made was that she feels that it should be more commonly known that it is really common.
Yeah.
That people have, because I think there's a difference, quite a severe difference. I know when I did my Samaritans training, we were sort of trained to try and, I can't remember what they called it now, the steps, I think it was. And there was like suicidal thoughts down to like plans.
Yeah.
And thoughts very, very common.
Yeah.
Obviously, if it gets to planning stage, it is a little bit more
Yeah.
serious.
Thank you for bringing that up, because I think that is a really key distinction, and it's what we're trained in as doctors, is to ask those types of questions, is to kind of ask, have you made any active plans, and how far that's gone, and things like that. But regardless, I think, if you're getting any form of kind of thoughts in that way, like 100% reach out and try.
Oh,
and,
yeah.
because it's a lot to deal with by yourself, and no one should be kind of dealing with those sorts of thoughts by themselves, but also, extremely common, as you say.
I mean, life throws things at you, doesn't it? And I mean, again, me personally, like some of the stuff I've been through in the past, I've probably had those very quick, fleeting thoughts of, do you know what? It'd just be easier to not be here.
Yeah.
And there's that, which I would imagine is quite low level, because it was I've never got to that stage where I've actually considered taking my own life or made plans to do so. But there's definitely been, that probably no more than 5 seconds.
100%. I think I'm probably similar to you. I've been, lucky to never have more like really active thoughts, but in deep depression periods, I've definitely felt like that. As you had, that, I don't want to be here, basically, because the pain is too much.
Yeah.
And that's it's extremely common. Yeah.
Yeah, it's a great answer, Henry. Thank you. Right, moving on. Do alcohol and drugs significantly impact somebody's mental health?
Yes, is the short answer. Obviously, will vary from person to person, but substantial alcohol use
Mm,
um, is definitely damaging for your mental health. There's a huge amount of evidence for this now. Alcohol is a depressant.
yeah.
Um, the public health has moved towards effectively saying no amount of alcohol is safe. Um, I'm probably not that extreme, but I think if you can have a healthy relationship with alcohol,
Mm,
you're occasionally having 1 to 2 drinks as a social thing or whatever. I think it can be done safely, but alcohol and drug use in general, can be extremely harmful for your mental health. If we're kind of relying on these substances to self-medicate, I suppose, what are we kind of not addressing? And obviously with alcohol and drugs, you're getting some sort of buzz or some sort of up, and then you're
mm,
inevitably going to get some
yeah.
sort of come down from that process. And a lot of that's explored in this book that I was talking about, Dopamine Nation. But uh, effectively, you can think about these like dopamine seesaws in our
Mm,
brain. And if you're giving yourself kind of free dopamine, whether that's with heavy drug use or alcohol use, um, the seesaw is gonna come down the other
mm,
side, and gonna lead to feelings of kind of depression and things like that. And over time, regular heavy drug use and alcohol use
mm,
means that our normal sober state is um,
yeah.
slightly lower down than usual. So we need kind of more stimulation to feel just normal. So we're running at kind of a deficit, if that makes sense. So
Mm.
yeah, it's a really good question, and I think it's
I think most people, if people would not want to admit that it's bad for your mental health, I don't think anyone would argue that it's good for your mental health.
no,
So,
probably not. I mean, some people have opinions that um, if you look at the blue zones, for example, places like Sardinia and
mm,
Okinawa, these places that have extremely high life expectancy and also typically often have families sitting around tables having a tiny bit of wine. So there are people who say, oh, maybe there's a protective element to it. I think it's probably more to do with
the
the,
social
the
element.
social elements of it and things like that. But I think we alcohol's an interesting one because it's this just mass normalized drug, isn't it? That we
But
treat differently to
in the
everything else,
UK,
but
yeah,
it's
it's so ingrained in our culture here, isn't it? That's the thing.
100%. And it's just being not judging ourselves at other people, just being kind of mindful of our
Mm,
consumptions and just being honest with ourselves about the effects that um, these substances might be having. And
mm,
also, one of the things she touches on in this book, Dopamine Nation, as well, is with every kind of substance, and she'd include phone use in this, as well as smoking marijuana, as well as alcohol, as well as
mm,
porn addiction, whatever it might be. Um, you Even if you end up doing that thing a little bit, so maybe it's alcohol, you have the occasional drink, everyone should go through a period where they're not having that substance at all,
mm-hmm,
just so you know that you can do that.
mm,
And then once you've had that period, you then might be able to kind of reassess. And for some people, with alcohol, that might be being teetotal forever.
mm,
And for others, it might be actually, I've had this break. I've learned, a lot about myself. I feel better in this way, X, Y, Z. But, maybe occasionally I have,
mm,
1 or 2 drinks. And for that person, that might be healthy. So it's going to be different for every person. But I think really thinking about having a break from that
yeah.
thing, and it takes time for your brain to actually become normal again as well if
Mm.
you're heavily using alcohol or drugs. So it can take, 6 weeks plus. So I think bear that in mind.
I think a lot of the thing with it as well, it's that spiral, isn't it, Henry, where people might be experiencing some kind of mental health low, so
Yeah.
they look for the solution, and they look for that solution in alcohol and drugs.
Yeah.
I think if somebody's in a really good place and stable place with their mental health, because I don't want to vilify alcohol, I mean, I drink.
Of course not.
But if somebody's in a good, stable place and, they go to a celebration or a social occasion and drink, it's not going to just snap you into poor mental health, but it's certainly not a companion to help mental health. And if anything, it's likely to send you on a downward spiral.
Yeah. No, for
So
sure.
I remember the last two. I don't need to refer to my phone. I've just realised a massive. That was you talking about time away from your phone, and there's me with the phone on the podcast, which is something I don't even normally do. But I was never going to remember all those questions off the top of my head. So there were two more, and the two I've put them at the bottom of the list together, but I'm going to remember them. One is. Also, I'm going to remember
Come
them, and I've had
on.
a mind blank. The Somebody asked how important is sleep to your mental health, which I know you've already glanced on today.
Unbelievably important. Matthew Walker, who's the great new kind of author, and I'm sure a lot of you have heard of him. He's got a great book called Why We Sleep.
Yeah, fantastic.
Talks
book.
about it as being this almost unspoken about kind of thing underlying a huge amount of mental and physical health. And I think because of people like him, it's being spoken about more and more. But it's massively, massively, massively important. And thinking about your sleep hygiene is the best thing that you can do about that. And by that, I mean things that will support your sleep. And that's the beginning of the day and the start of the day, right? So your circadian rhythm is a kind of balance of hormones in your brain that dictates when you feel sleepy and when you go to sleep. So it's typically influenced by sunlight, right? So sunlight in the morning stimulates cortisol, which is the wakefulness hormone, and then in the evening, lack of sunlight stimulates melatonin, which is the sleepiness hormone. So we kind of want to be in line with that. So one great thing you can do in the morning is get outside as early as possible into sunlight. Quite difficult in winter, I know, but you could use artificial light in the house or get one of those Lumi alarm clocks, which I have, which are quite good.
What are those?
They're just alarm clocks that wake you up with lights as opposed to like just noise. So you're kind of stimulating what it would have been like 20,000 years ago when we would kind of wake up.
Does that work to wake you up? Have you ever slept through it?
So I have an alarm clock with it as well. I've got bird song in it as well, because I like the idea of like natural sound in the morning rather than a really kind of jarring alarm clock. So morning stuff is part of your sleep hygiene. I think that's really important to stress. But most importantly, when you're going to bed, it's thinking about what you can do that's going to promote good sleep. Okay, so that's not exercising very last thing at night. That doesn't help. Limiting artificial light right before bed, winding down your lights, winding down your overall stimulation, giving yourself, if you can, a good kind of hour period where you're really winding down. I think like reading in bed with dim, warm lighting can be fine, but I think just try not to overstimulate yourself. And then the number of hours, everyone wants to know about the number of hours. It's different between everyone, isn't it? I think typically quoted is like between 6 and 8 hours, should be okay. But it's also the quality of your sleep. We have these different cycles, deep sleep and REM sleep. And
connecting again, alcohol will affect the quality of your sleep.
Yeah, such a good point. And there's that awful phrase like that alcohol's like a nightcap, because you feel sleepier with alcohol, right? And so people think, oh, it helps me get to sleep. And you might feel sleepier, so maybe you do get to sleep faster, but actually the quality of your sleep is really, really poor after drinking quite a lot. And we know this from looking at scans of people's brains and looking at all the different cycles of sleep. And so that's why typically when you've drunk a lot, you're hungover, but you're also really, really tired. And it doesn't really make sense because you think, oh, I've slept 8-9 hours. Why am I still tired? And that's because the quality of your sleep's really poor. So it's not just quantity, it's quality as well.
Great point. It's a great point. It's, again, it seems to me a lot of the sort of theme really is the connecting points. It's all these things that connect together. Alcohol leads to poor sleep, leads to and the spiral.
Yeah, and like just to stress, because I think sometimes mental health conversations can feel like we have to be perfect at all
Yeah.
these things, and also that we're kind of not enough as we are right now. And I think we should stress that actually, don't, all of this stuff, it's great to talk about this stuff, and I obviously really like talking about this stuff, but we can't do everything, and a big part is just awareness
It's a really
and
good point,
doing our
mate.
best on these things, and having these thoughts in our head about sleep hygiene, about connecting with friends, about being off our phones, etc., but not penalizing ourselves if we occasionally don't kind of
I
live
think
up to that.
the way I see these conversations are, if you're doing well in life and you're quite happy, then fine, brilliant, that's great, that you don't have to change anything. However, if you are experiencing a mental health low point and you're struggling and you're not feeling right, is this information's great to maybe look at your overall sort of surroundings and your situation and see what you can improve. Maybe if those things, any of these things we're talking about, ring true, and you think, well, I'm struggling with my mental health, I've been feeling low, but you know what, haven't been sleeping well, is then look at that and just try one of the things to see the benefits.
That's the thing. It's a jigsaw puzzle with mental health, isn't it? You've got loads and loads of different
pieces to it,
that can help form positive mental health. I like this acronym clangers that
what was that? Sorry, clangers.
Clangers. I'll go through. I've used religiously over the years, so my friends will make fun of me for talking about it now. But it's based on research from the New Economics Foundation, and then a doctor called Dr. Phil Hammond added in a little bit as well. So it stands for connection, learning, being active, noticing. So that's that mindfulness thing. Giving back, eating well, relaxing, and sleep.
Okay.
And there's significant evidence behind each of these little points. The first 5 were done by research from the New Economics Foundation. They interviewed thousands of people and asked them kind of what the things are that support their mental health in the biggest way. And then the remaining 3, diet, relaxation, and sleep, were added in by this doctor, and also have a lot of evidence behind them. So the reason I like that is because it shows that there's so many different parts of this to support our mental health. It's not just one thing. So I think it can be useful, like little acronyms like that, little things to remind ourselves of. If we're not feeling 100%, just to have a look at that. Maybe you can look at your list of clangers, and you look at each thing and you think, oh, have I been connecting with my friends actually much recently? No, I haven't. Okay, well, maybe I'll try that a little bit. Maybe I'll just reach out. Maybe I'll send a message. Oh, do you know what? I haven't actually been eating well at all recently. I've just been having takeout after takeout and loads of sugar. Maybe I will, change that a little bit. Or my sleep's been terrible recently. It might be, a couple of those things. And it can help having those kind of frameworks to just
no, it's perfect, mate. It's a great explanation. The final question, Henry, which you've just touched on now, is what do you misquote it? I don't want to upset somebody that took the time to respond. What do you think of the connection between gut health and mental health? Now, this might have led on to, I did an episode a few episodes ago with Sophie from The Basic Nutritionist, revolving around gut health and mental health. So potentially somebody that's listened to that one.
Yeah, okay. So, definitely not an expert in that area. So I'm sorry about that. And actually, at medical school and as doctors, we're taught very little about this and that relation, which probably surprised a lot of people. But completely accept that in recent years, there's been more and more evidence that there is this, really interesting relationship with the quality of our kind of gut health and different proportions of different gut bacteria and our overall physical health, our levels of inflammation, our ability to fight off certain diseases, but also our mental health. Because mental health is often incredibly linked to physical health, isn't it? They're not necessarily separate things. And, something like the stress hormone cortisol, for example, has got a role in inflammation as well as stress. So there's huge overlap. And there's a whole movement kind of in recent years, like food and mood, and thinking about, our diet and different kind of foods that we're getting in our diet and how that does impact our mood, and lots of really interesting evidence in that area. I'm not super familiar with it, but just
That's absolutely fine, mate. That's like you said, you can't know absolutely everything, but the connection appears to be there. So
100%.
hopefully that's answered. I think that's all the questions. Do you know what? For 2 hours, I was pretty damn impressed that came in that sort of period of time. So yeah, thank you very much for answering all those. I think, generally speaking, mate, there's been so much value that you've added to the whole topic and conversation and reinforced some of the things that we've spoken about in the past. Before we do wrap things up, Henry, is there anything that we haven't spoken about that you really wanted to get in?
It's a good question. I should have prepared for that, shouldn't I?
Well, not necessarily. If you think we've covered everything, then we have. But if there was anything that you walked through the doors today thinking, must not forget to.
No, I think we covered a lot of stuff, didn't we? I think we did pretty well. So
I think so. I think maybe to wrap things up with the fact that you are a doctor and all of that side of things, what would ask you to say maybe to anyone that's listening that might have listened to what we've talked about and thought that, do you know what, actually they might be in a dark place or they might be struggling with their mental health, what would you advise people do as a first step?
yeah, I think first step is just to kind of almost congratulate yourself at the start that you've acknowledged that and you have that awareness. That's like 100% the first thing that you can do and first step in getting help. And then to reach out, and you'll know who the best person is for that. It might be a close friend or family member who you know isn't going to invalidate your feelings and is able to actually just listen and support you and allow you to feel heard. And then also thinking about kind of professional help, and that doesn't need to be down the mental health specific route at first. You could just try and arrange an appointment with your GP. I know that can be difficult for some people nowadays, but do your best with that, and hopefully that GP will be someone who is able to listen to you and give some advice and link you up with any support that you might benefit from, and just kind of start that process. And I think just thinking about mental health in that sense of being a bit of a jigsaw puzzle sometimes, and thinking about
Looking at the pieces.
all
Yeah.
those different pieces. Yeah.
Fantastic, mate. Appreciate it. It's been great advice. Great to hear your perspective. Thank you again for all the effort that you've made to come in here today. Again, before we wrap things up, do I just let people know where they can find you, give you a follow and all the rest of it? I know we've mentioned it a couple of times, but we'll do it again.
Yes, so it's just Doctor Mental Health on Instagram, so Doctor_Mental Health. Give me a follow, and please reach out if you've got any questions about anything, or want to collaborate over anything, or
Fantastic.
it'd be good to hear from you.
As always, I'll put Henry's details. There'll be a link to his Instagram in the episode description below, so scroll on down, you'll be able to follow it with a link there, so just give that a click and give Henry a follow. Before we do wrap things up, quick shout out to the Funky Peach workwear for all of the guest merchandise that they're bestowing upon my fantastic guests, so thank you very much to you guys, and a big shout out to Steve at Uncle Matt's Hats again for the hats that are being distributed to my guests for the next 6 months. So massive thank you to you for supporting the podcast. Thank you to everybody that's listening. If you haven't already, please like, share, subscribe, do all that cool stuff, and I'll catch you soon on the next one.